If you wake up and you're not feeling well, please stay at home. Anyone with symptoms like fever, cough, or shortness of breath should notify their supervisor immediately. Follow the CDC recommended steps to help you get through your recovery. When you are feeling better, contact your supervisor. They will share HR's return to work process with you. If you are well, but have a sick family member at home with COVID-19, or have been in close contact with someone who is symptomatic, you should immediately notify your supervisor and stay home. Even if you wake up feeling healthy, a good practice is to take your temperature. Perhaps you are concerned about contracting the virus. Maybe you have young children, or you may be caring for someone who's at an increased risk. If you do not feel comfortable for any reason, contact your supervisor to work out a plan. Don't forget to put on your face covering, bring your hand sanitizer, and a paper towel. You should have your face covering on before you arrive at work. When you approach the security guards, make sure to keep your distance. You are now required to scan your badge at the secondary security checkpoints. Be careful not to touch the card reader with your bare hands. After passing the checkpoint and parking your car, it is recommended to carry your paper towel with you as you walk to your workstation. The paper towel will help you avoid touching surfaces with your fingertips. There is an increased risk of transmitting the virus when touching surfaces without a barrier. If you're going to use an elevator, take note, only 3 people are allowed in the cabin at one time. If you witness someone who is not following the Safe at Work protocol, kindly remind them. If the individual continues not to follow the Safe at Work protocol, or you do not feel comfortable approaching them, contact your supervisor and inform them of your concern. Supervisors will talk to the person and ensure that protocols are followed immediately, while keeping all sources confidential. When you arrive at your workstation, make sure to disinfect all surfaces and the devices. If you work in an open area, make sure to clean your area frequently. If you are feeling sick and are at work, or were physically on site within 48 hours of your symptoms developing, go home immediately and inform your supervisor. The definition of shedding, according to the Merriam-Webster Dictionary, means to give off discharge or expel from the body. Every single one of us could have COVID-19 without even knowing it. To protect ourselves and others, we must do everything possible to prevent the shedding. Avoid areas that are not in use and avoid using office equipment whenever possible. Cover your mouth and your nose with a tissue if you sneeze or cough, and use the inside of your elbow. Avoid sharing equipment whenever possible. And if you do share equipment, disinfect the equipment before and after each use. You must regularly disinfect your own workstation, any shared work areas, and equipment. Be sure to wipe down desks, counters, refrigerator doors, microwave controls, doorknobs, shared tools, and shared machinery. The clean room environment offers an extra layer of protection as a result of the ventilation design. Gowning rooms should be used by one person at a time. Air showers also one at a time, and change your clean room garments based on your work area procedure. Increased air circulation contributes to reduced risk of exposure to the virus. During this time, it's important to eat lunch at least 6 feet away from anyone else. preferably much more since face coverings will be removed. Remember, 6 feet is a minimum distance. Stay as far as possible from other people. Particles can travel up to 26 feet. Clean your area before and after you eat. No one knows where the virus is. People can spread the virus before they ever know that they are sick. Face coverings may provide a false sense of security, and it is imperative to maintain social distances. In addition to other safety measures, avoid crowded areas and mass gatherings. Avoid shaking people's hands. If possible, avoid using any kind of public transportation, ride-sharing, or carpooling. If you can, continue to work from home. Protect your family and loved ones. Upon arriving home, make sure to remove your shoes before going inside. Make your first stop the bathroom. Carefully remove your face covering and wash it in hot, soapy water, or as per the CDC guidelines. To reduce the risk of shedding the virus in your home, it is important to wash the clothes that you wore during the workday. It is also smart practice to take a shower before going into the rest of your home or conversing with other people. Change your clothes and make sure you wash anything that you might have touched on your way into the home. If you or anyone else in your home starts to feel sick at any time, notify your supervisor immediately. Understanding what measures you can take and what is the most effective prevention to the least effective protection will help keep you, your colleagues, and your loved ones safe. Have symptoms? Stay home. Put on a face covering. Use hand sanitizer. Wash your hands frequently. Do not shake hands. Stay at least 6 feet from coworkers. Wear safety goggles or glasses. Clean your workstation and don't put yourself or others at risk. If we work from the assumption that we are all potential carriers of this deadly virus, we will protect each other at work, our loved ones, and the world. Break the chain.
People all over the world are now being affected by the impact of the coronavirus disease, Covid19. As the infection continues to spread, WHO recommends that all laboratory-confirmed cases be isolated and cared for in a healthcare facility where possible. People suspected of being exposed to the virus can self-quarantine at home. Others who are experiencing mild symptoms of the disease but cannot go to a healthcare facility may also receive care at home with the support of family members. If you are experiencing mild symptoms, such as fever and dry cough, without having underlying health conditions, communicate with your physician and discuss if you can manage your symptoms while isolating yourself at home. Wear a medical mask as much as possible. If you cannot tolerate wearing a mask, then cover your mouth and nose with a disposable tissue when you sneeze or cough, and dispose of it properly. If you use a handkerchief, wash it after use. If you need someone to care for you, then assign one person who is in good health and has no underlying chronic conditions. Caregivers looking after patients should also wear tightly fitted medical masks that cover their mouth and nose. If secretions contaminate the mask, it should be replaced immediately with a new one. When removing your mask, do not touch the front. Discard the mask immediately after use and wash your hands. Do not reuse a mask or gloves. Stay at least 1 meter away from other household members, especially the elderly and people with underlying health conditions, as they are at higher risk for more serious complications from COVID-19 and need to be protected. Visitors should not be allowed until you are completely recovered. Limit your movement at home. To avoid sharing spaces with other members of your household, ensure that shared spaces, such as the living room, dining room, kitchen and bathroom, are well ventilated. Sleep and stay in a separate room. If that is not possible, try to maintain a distance of at least 1 meter from other people in the house. Wash your hands with soap and water often. Wash your hands also before and after preparing food, before eating, after using the toilet, and whenever your hands look dirty. If your hands are not visibly dirty, you can use an alcohol-based hand rub. Use paper towels to dry your hands after washing, and dispose of these properly in a closed bin. Otherwise, use a cloth towel, but ensure that it is not shared with other people and is washed regularly after use. Do not share eating utensils or linen, and always clean well with soap and water before reusing. Tables, bed frames, furniture, doorknobs, and frequently touched surfaces in all rooms must be regularly cleaned. All surfaces must be rinsed with soap or detergent before applying disinfectant containing 0.5% of sodium hypochlorite. Clothes and towels should be hand washed with detergent and hot water, or machine wash them at 60 to 90 Celsius. Do not share toothbrushes, toothpaste, eating utensils, dishes, cups, towels, washcloths, or bed linen. Do not smoke, as smoking can increase your risk of developing serious disease when you are infected with COVID-19. If you develop more severe symptoms, such as shortness of breath or chest pain, contact your healthcare provider to seek medical support. During these difficult times, do stay active and socially engaged. Maintain a healthy lifestyle by eating properly, sleeping well, and exercising regularly. It is normal to feel sad, stressed, confused, scared, or angry during a crisis. So talk to people you trust. You can stay connected with your friends, family, and colleagues through telephone, email, social media, and video conferencing. Get your information about COVID-19 only from trusted sources, such as WHO and your national health authorities, and try not to read or watch too much news if it makes you anxious.